start with the health department. I believe they were up next. And with the health department, we will start with Zach. Come in.
The proposed FY 2022 budget for the Department of Health totals $122.5 million, an increase of $22.7 million or 22.7% over the FY 2021 budget. The general fund portion increases by $1.5 million or 6.2%, primarily due to increased personnel expenses. The special fund portion increases by $21.2 million or 28.1%, primarily due to two new FY 22 COVID-19 grants, one federal and one state funded. On page 2, the pie charts show how the proposed funding will be allocated across programs and types of spending. General health grants represent the largest program allocation, while personnel costs represent the largest spending allocation. On page 3, significant changes in the budget are summarized, including $768,000 for personnel changes and a combined $20.6 million in new COVID-19 grants for FY 2022. On page 4, the analysis identifies various FY 2022 budget highlights, including some detail on the new and deleted positions, new grants, and some information on capital projects. Also on page 4, the analysis identifies no specific operating budget reductions. However, to the extent proposed budget includes funding for expenses that could be reimbursed under the $161 million in anticipated but not yet budgeted federal funding to the county government. Additional reductions could be made. More information on the spending plan for those ARPA funds may become available as the council considers the administration's request to appropriate ARPA funds under Bill 4221, which is on the council's May 27th agenda. Other topics for discussion, which begin on page 5, include personnel, the impact of COVID-19 pandemic on operations and reopening plans, mobile crisis team expansion, and capital projects. At this time, I would like to turn it over for discussion.
Thank you very much, Zach. And at this time, we would like to call on the one and only savior of the Baltimore County, Dr. Branch, who's leading the health department, and we have nothing but the utmost respect, love, appreciation, and gratitude for you and all the efforts your staff has done to protect us through this very, very trying time, once in a lifetime event, we certainly hope. Dr. Branch, take it away.
Good afternoon, Chairman Jones and distinguished council members. I want to thank you for the opportunity to come before you today on behalf of Health and Human Services and the over 830,000 Baltimore County residents who depend on us. The majority of these residents are not aware of the crucial role health plays in the day-to-day of their lives. That is why I welcome the opportunity to come before you each year to highlight what we do, how we do it, and why it's imperative for us to receive your support in order to continue strong. And so my goal today is to provide a snapshot of the impact we have made on behalf of our residents since the last coming before you a year ago. First, I'd like to introduce my leadership team, who I'm quite sure is here. I would just like to mention Della Leister, the Deputy Health Officer, Mark Millsper, Deputy Director of Social Services, Terry Hickey, Deputy Director of Housing and Community Development, and Lawrence Richardson, the Deputy Director of Finance and Administration. This team and their staff are truly the wind beneath the Health and Human Services wings. We continue to soar to unprecedented heights as a direct result of their commitment and their dedication to our work. And I have to take this opportunity to thank them for their support. So thank you wholeheartedly to my team. In order to give you a snapshot that I mentioned earlier, I'm going to talk to you about the tale of two pandemics. COVID-19 and opioids, the tale of two pandemics. In reviewing 2020 and our expectations for the rest of 2021, it is befitting to borrow from Charles Dickens, who wrote, "It was the best of times, it was the worst of times. It was the spring of hope, it was the winter of despair." And that holds true for health and human services because of the two pandemics we are continuing to navigate. But let's look at our first pandemic, COVID-19. We started tracking this new coronavirus in December of 2019. And in January of 2020, we were participating in regular updates and planning sessions with the federal, state, and local partners. And by March of 11th, when the World Health Organization declared COVID-19 a pandemic, the Department of Health was already leading Baltimore County's mitigation response. And at the end of April 16, 2020, less than 24 hours after receiving the long-awaited testing kits, we opened our first county-operated testing site at the Timonium Fairgrounds with only 24-hour notice. And from the start, this drive-through testing site heralded national attention from around the country. And within 2 weeks of opening that first site, we had 4 additional sites fully operational and were providing testing services 5 days a week. And over a year later, we are still testing 5 days a week. We have varied our locations to ensure that safe and convenient testing is available in communities heavily impacted by the virus. Now, while supplies have not been an issue for some time now, you might remember that testing kits were initially extremely scarce. And at that time, outbreaks were awfully common. This was especially true in congregate and long-term care facilities. And as a result, our outbreak staff were working early on with the congregate care facilities to help them mitigate and contain outbreaks as they occurred. It was not unheard of for this outbreak team to provide support and monitoring to upwards of 200 active outbreaks locations at any given time in Baltimore County alone. This was a major undertaking, considering the fact that Baltimore County has the largest long-term care capacity than any other county in the state. And a year into the COVID, this team continues to provide outbreak support to these facilities. And as I mentioned, congregate care facilities are especially prone to outbreaks. In addition, Baltimore County addressed this potential threat in the homeless shelters early on. We were the first jurisdiction to move our high-risk homeless individuals out of the shelter and place them into hotels. As a result, we never had an outbreak at our homeless shelters. Much like waiting for the testing kits, the long wait for the vaccine was another issue that we met head on. And I would like to take this opportunity to thank Rob O'Connor and his IT staff for building a vaccine registration portal in what seemed to be less than 24 hours. And this helped us to efficiently and effectively serve first responders, healthcare providers, and frontline personnel when the vaccine finally arrived. The first doses of the life-saving vaccine were distributed to the state, and then it came to the local health departments on December 23rd, 2020. Within hours of receiving our allotment in Baltimore County, we mounted our first vaccination clinic and put all 200 doses we received into the arms of the healthcare workers and the first responders on the day that we received the vaccine. And from that day to this, we have moved expeditiously to get every dose of vaccine we received into awaiting arms. And we continue to garner attention because of our mass vaccine distribution efforts. Early on, we touted higher vaccination numbers than any other county across the state. Additionally, our operation is recognized as a model for other sites across Maryland and across the county. For instance, after touring our site on February 8th, 2021, Governor Larry Hogan said, and I quote, "I have not seen a vaccination site as well organized or as well thought out as the one that we walked through today." And that was Baltimore County. The CEO of PrepMod, which is the online resource used in 28 different states for vaccine clinics, that CEO points to us, Baltimore County, as a top in mass vaccination distribution efforts, barring none. Nationally recognized as a certified physician executive, I was invited to participate as a panelist in multiple national forums to discuss best practices related to mass vaccine distribution. And hundreds and hundreds and hundreds of written accolades continue to pour in from our residents who are served at our locations. And the majority of these accolades highlight the efficiency of our clinic. They highlight the positive interaction with our helpful staff and the attention to detail that goes into making every visit a top-notch experience from arrival to departure. That's that Disney experience. From the golf cart drive from the parking lot, to the transportation ambassadors pushing wheelchairs, to the less than 15-minute wait in line, despite serving 700 to 1,000 residents per hour. I would be remiss if I didn't tell you about the elderly resident who came to our Timonium Fairgrounds clinic. And after she received her vaccine, she went to her car and she cried. Now, obviously, we were concerned, thinking we were having a reaction to the vaccine. But upon eliciting additional information, it became evident that she was simply overwhelmed with the positive experience she had. See, she had come prepared to the clinic with her book, her needlepoint, and her other activities to keep her busy, as she thought, based on the news reports of other vaccine sites, she would be in line for hours. When she was in and out in no time, she was just simply overjoyed. So I can't help but be impressed by what we accomplish each time I think about our operation. But what I'm most impressed by is the fact that at no time during this pandemic did we discontinue providing the many regular services that residents need and depend on the Department of Health to deliver. This has not been the case in many other jurisdictions that decided to suspend some of their services in order to mount a COVID response. For example, we still have to monitor and inspect opening and closing of our food facilities. And in Baltimore County, we still do not have an adequate amount of staff to meet the required mandated inspections. And we are grateful if we can receive those 6 additional FTEs to help bridge that gap. See, in Baltimore County, however, we immediately began to rethink what we think about service delivery and came up with alternative ways for meeting the needs of our customers. No, ladies and gentlemen, we never decreased our service delivery. On the contrary, we increased it by putting infrastructures into place to address the onslaught of additional needs created by the pandemic. And that included the COVID-19 hotline, It was available 7 days a week when initially launched, and we've been responding to approximately 60,000 calls since the lines are opened. And the hotline staff helped to coordinate services for individuals who were in isolation or quarantine. We had our health equity team, which assists the minority population to better access testing and vaccination resources. Additionally, this team had distributed more than 310,000 safety kits in communities hardest hit by the pandemic. Our contact tracers, they connected and provided support to individuals who've tested positive for the virus and their potential contacts. Our outbreak investigators provided support to nursing homes, long-term care facilities, and educational institutions to help mitigate and contain outbreaks. It was not unheard of for this team to have upwards of 200 active cases at any given point. Our testing operations, ongoing 5 days a week at 5 convenient testing sites. Our mass vaccination distribution continues at 5 clinic locations across the county, and it also provides homebound individuals with the vaccine. And our mobile pop-up vaccine unit, it was launched on May 1st and coordinates with communities across the county to provide vaccinations for underserved and hard-to-reach populations. We have successfully added these efforts by reassigning health department staff, utilizing enterprise-wide staff, and onboarding temporary employees. And we utilize our CARES Act funding to cover the expenses associated with these mounting efforts. This funding was also support our health equity VOIC voice initiative, vaccine outreach initiative for community equity. And there is still much left to do. Yesterday, the use of Pfizer vaccine for adolescents aged 12 to 15 was approved. And the final state approval was confirmed at approximately 6 p.m. last night. And ladies and gentlemen, I'm proud to say, I want you to know that we started vaccinating these adolescents today and are hosting Pfizer clinics for the rest of the week and throughout the weekend. This comes with its own set of challenges, and there are some 36,000 residents in that age group between 12 and 15 in Baltimore County. We're buying additional a mobile outreach unit in order to serve the Black and Brown communities, and we'll be asking a workforce to handle, we're going to ask our Health and Human Services workforce to handle these added responsibilities on top of the fatigue and the COVID weariness they're already experiencing. Yes, our workforce is tired, but we are strong. These are the best and the worst of times. And easily this past 14 months has been the worst of times. We confirmed our first case of COVID on March 12th of 2020. We confirmed the first Baltimore County death on March 18th of 2020. And as of this morning, there were almost 65,000 Baltimore County confirmed COVID-19 cases. And unfortunately, 1,466 confirmed deaths. This pandemic is unprecedented in so many ways. And we have not had a public health crisis in magnitude within our lifetime. And as a result, we are literally building the plane as we fly it. We're charting the course while developing the GPS, and we're changing the tire while the car is still moving. However, in the midst of all of that, we can continue to stand together while staying apart. Our ability to stand strong and stand together to defeat this virus is a testament to being the best of times. What does standing together and standing strong look like? It's not only providing food for individuals in quarantine due to COVID, but it's also delivering it to their doorsteps so that they don't have to come out. It's not only making those food deliveries Monday through Friday from 9 to 5, but also making those deliveries during the early mornings, the late evenings, on weekends, and on holidays. And showing up to help direct the traffic or to serve as a wheelchair porter at one of our weekend clinics, even after working all week in your regular health department assignment. The pandemic opioids, number 2. COVID-19 continues to capture everybody's headline. But before we were united in the fight against that virus, we were addressing the toll opioids were taking in our communities. The opioid crisis has affected families around the world and around the block. We'll be hard pressed to find anyone without a family member, a friend, a loved one whose life has not been impacted by the opioid crisis. And that was the case before COVID-19 happened. And it's certainly holding true during the pandemic. And what we know for sure is that opiate misuse most often is connected to mental health issues. And the COVID-19 pandemic increases the occurrence of triggers like job loss, increased anxiety, depression, social distancing and isolation, and each of these things negatively impacts mental health. The Department of Health and the Police Department are moving forward with an expansion of our mobile crisis team in an effort to better address the need for increased mental health services. And this expansion of services means an additional 3 clinical staff and 4 specially trained police officers going out into community, resulting in the ability to dedicate a response team to serve the central portion of our council, which will then add on to the east and the west sides of our county. We're going to also add a call center clinician program, which makes it easier to serve people on the front end at the initial call to 911. And it provides the opportunity to de-escalate occurrences over the phone, decreasing the need to go out in many instances. This will improve our diversion from our emergency rooms and the detention center. And in addition, the Overdose to Action grant is making system changes to combat the opioid epidemic. And this includes our just-in-time database, our case management software package to provide the ability to track interventions and successes, and the expansion of our harm reduction program. The best of times and the worst of times. And it could be the worst of time because as COVID-19 and the opioid pandemic continues, the number of residents that we need to be serving in the program will undoubtedly increase. However, the bottom line is that this is the best time because more patient-centered, patient-focused services is being made available to residents at the outset of contact to the planned expansion of our mobile crisis services. So, over the past 14 months, I have continually reminded our staff, I've reminded our partners, I've reminded this body and the public that this is a marathon and not a sprint. The reality of the situation is that we are sprinting through this marathon. And this is still very true even as we are beginning to experience increased vaccine supply and decreased vaccine demand. So as we steadily move towards what we hope will be the end of this pandemic, we must expect the best, but continue to prepare for the worst. We are seeing increased occurrences of new variants, and we are not able to predict how this will ultimately affect public health. Since my start with the health department in 2006, we have had multiple public health threats, including H1N1, influenza, Zika, Ebola, opioids, and COVID-19. It is therefore critical that the Department of Health is prepared, equipped, and supported in our ongoing efforts to protect and serve our over 830,000 residents. So I want to take this opportunity to thank our county executive. I want to thank him for his vision. I want to thank Madam CAO. I want to thank her for her leadership. And I want to thank each and every one of you in advance for your partnership in protecting the public during these unprecedented times. I look forward to a favorable response as it relates to the HHS, the Health and Human Services budget. And to be more specific, I'm praying for a spring of hope and not a winter of despair. Thank you for your time and your attention. God bless you.
Well, thank you, Dr. Branch. And I tell you what, Director Blades, why don't you collect the admission of all the people watching, because they certainly need to pay for that performance that we just saw. Dr. Branch, you are without a doubt an exceptional orator, and you did a wonderful job. But most important to us here in Baltimore County, you are an exceptional healthcare professional who led the health department in our county at a very critical time. And I'm very happy that we have you, and I'm happy that you received the accolades all around the world and across the country, because they know what we always knew, which is you're a top guy, and we're happy and proud to have you. So I'm gonna start. If you give me 1 minute, Ms. Evans, I'm gonna start with Councilman Quirk, and then Councilwoman Beck.
Thank you, Mr. Chairman. And I would clearly like to jump on this bandwagon, and I'm certain a lot of the other council members are going to as well. But definitely right person, right time, right place. Exactly what we got with Dr. Branch and the people that work for Dr. Branch. The whole department really stepped up, and just incredible. I mean, I'll tell you, I'll echo the same comments that Dr. Branch mentioned. Is everywhere I go, I have people come up to me completely unsolicited and say, "Hey, I got my COVID shot," and I couldn't believe how quick it was and how efficient it was. It was like an army. Like everything was regimented, everything was really, really well designed. I had the same experience. My first one was at State Fair. I mean, the Timonium State Fairgrounds, and my second one was at Essex Community College. It was incredible. I mean, the longest I had to wait was just waiting to be observed for that 15 minutes to make sure I didn't have any adverse reaction. But I was completely impressed by the organization ability that the whole department exhibited, and the amount of resources. It was incredible. And I heard that from literally dozens and dozens of citizens when I'm out in public. They just come up to me like they always do for all the council members. And often it's, concerns and maybe negative stuff. So it's wonderful to have people come up to you and say things that are positive. And that's what I've heard consistently and dozens of times from constituents. So Dr. Branch, job well done. And obviously to the whole department, thank you guys for just exceptional work during exceptional challenging time. And so we definitely appreciate it. Two quick questions, and then I'll be quiet. The first question is, Dr. Branch, I heard you mention today that I think as of today, we're starting the clinics for the kids ages 12 to 15. If I know lots of parents that have kids that want to get their vaccine shots, fortunately, where do I tell them to go? How can they sign up through the county? What mechanisms can we what can we tell them? What's the best way for them to get their kids in line to get the shots?
Well, if you go to the Baltimore County website, you can see all the locations. What's really nice at this particular time is that all of our locations are walk-in. So they can actually click on the link there and make an appointment, or they can just walk in during those hours and we'll see them. And also, I'll let you know that we do have some vaccine clinics going on at our school wellness centers and in some of our schools. So it's kind of all over the place. And even the vaccinations in the school wellness center and in the schools, they can vaccinate not only the child, but their siblings and their family members.
Great. And that started officially today? Did you
started already? Yes.
That's wonderful. And that's great news, and thank you. So just go to the website. We can see the locations, and they can walk in if they went to one of the locations. So they don't necessarily have to have an appointment, but they can also schedule an appointment.
Exactly.
Okay. That's great. No, good. Yeah, that's fantastic news. And then the other question, when I was looking at the auditor notes, is on the percentages of vaccinated in the county, I note that it says 44.9% of the population had their first dose, 33.7% second dose. I'm not sure how that compares versus other municipalities. I'm not really sure how does that compare. And then the other thing is more anybody that's not getting their vaccinations. What can we do to just encourage them to, do the right thing and get it done? It's good for them. It's good for the community at large. So those are kind of my two questions. And
So
thank you.
we are very comparable to other jurisdictions in regard to our vaccinations and the percentages. You have to look very closely at what the percentages are. Is it going to be the percentage of the entire population or the percentage of the population that can be vaccinated? Those are two different numbers, but our numbers are very comparable, and if not better than most other jurisdictions. So I'm very proud of that. Your second question was related to, remind me again.
Yeah, the second question is more about the people that are dragging their feet to get their shots, or maybe they just simply don't want to get it. What can we do to really bring them out and get their shots I guess what are we doing on that front?
Those are two different groups usually. The first group are the group that are kind of unsure and needs a little bit more coercing, if you may say, or they just prefer to actually go to a place located in their community. So what we've done is that we've got a PSAs out there telling everybody about it, and we're putting the vaccine clinics in the community. And then unfortunately, there's another group that just won't take it, right? So I can't make them take it at this point now. But for the group of people who are interested, who are a little weary, or who will take it if we're in their community, we're working with those people.
Dan, I really do appreciate that, Dr. Branch, because I have seen some emails from various kind of groups, let's call them the anti-vax groups, and some of these emails are just filled with a bunch of nonsense and baloney. And it's unfortunate there's some people that actually believe this stuff going around. So I think just getting the facts out there that, this is a Pfizer, Moderna, or these are Johnson & Johnson even, and just making people feel comfortable that this is something that's going to help them and it's not going to harm them. But because some of the emails I've seen, I'm just kind of disgusted by it out there. Some of this crazy nutball stuff, and so just trying to get the facts out there and really make sure people understand this and how important it is, I think, is good stuff. But Dr. Branch, you're a rock star, so thank you very much. We really appreciate it. We appreciate your department. I'm telling you, you guys are incredible. So thank you.
Thank you.
Councilwoman Bevan.
Thank you, Mr. Chair. Dr. Branch, I'm one of those people that believe that people are put in our lives for a reason at a certain time in a certain place, whether it's, whether it's for good or bad. And I truly believe that you are here in this place and time, and you were picked for this reason. Your education, your knowledge, your whole understanding, and more importantly, your heart for people during this really, really terrible time. And, we got to see it up close and personal. We got to deal with, I'm sure everybody's office was the same as mine. We were just dealing with people every single day that were either sick or wanted to know when they could get a vaccine. And they just were so desperate. And your office, your agency was just so willing to help people, especially when the county announced helping the homebound. Somebody called me personally and said, give me your list, and within a week, those people had been visited and those people had their shots. And one man, it was his 100th birthday. And I can't tell you how grateful people were to have that experience. And I really do believe that you were here for a reason for all of the COVID. And I know you've had a lot of accolades about all this. And I know that your people are tired. I know that. how can you not? You know, the amount of hours that people are putting in to make our clinics so successful and get so many people vaccinated. But what was also so impressive to me, Dr. Branch, is when people were calling through the entire year that had other issues that fell under the jurisdiction of the health department that weren't COVID related. Doris and I would just roll our eyes and go, oh God, like when is the health department going to even have a chance to look at this? They're so overwhelmed with COVID. That wasn't the case. That was not the case. You still were handling every single constituent issue that was coming in besides COVID. And, we had people that needed resources because they had lost their jobs and they didn't know where to go. They were on food stamps for the first time. They were on unemployment for the first time. They weren't able to pay the rent for the first time. There was just so many things that people were afraid of, and no matter who called them back from the health department or who we talked to in your agency, it was just like this calmness. Your agency was just able to calm people through this whole horrific ordeal. So I especially am very grateful for that, and will always be grateful for that. So thank you.
Mr. Chairman?
Yes, Ms. Rogers, did you have a comment? I know you had your hand up earlier.
No, sir.
Okay, Councilman Marks?
Yeah, thank you. You're going to get a lot of love today, Dr. Branch. I think you were the last cabinet secretary that was on board when Councilwoman Bevins and Councilman Quirk and I took office. And you have really grown into this role. I've been a pain in the butt sometimes to you over the past decade, and I recognize that. But you are an exemplary public servant. You have done a terrific job, and I'm very proud to have voted for your renomination all these times. You're just a stand-up guy, and very appreciative for all you did. I took my now 18-year-old son to the fairgrounds yesterday after the budget hearing. He got his shot. I'm going to try to get my daughter over there. She's 12. It's just a wonderful operation. I want to echo what Councilwoman Bevins said. Every time we had a non-COVID related situation, you helped out. Della was terrific. Christina Bergman was terrific in your office, working for Della. Thank you, thank you, thank you. You've been a star.
Thank you. And, Dr. Branch, I went to the community center today, took my daughter down there to get her shot. No problems. And I was happy to see a 12-year-old was there today, as well as quite a few young people, some 15-year-olds and 18-year-olds. So, it's working and people are taking advantage of it. And I'm just very, very proud. I echo what everyone has said today, especially the fact that so many people would talk about the experience they had and how well run everything was. And I realized that was an all hands on deck. So my hat off to the county executive as well as Ms. Rogers, who made sure you had the resources necessary to do the job you were capable of doing. So I know sometimes that's the best you can do, is give the resources and get out of the way. And they did that. And you were certainly, as Councilman Quirk said, a rock star. I mean, you made us all proud here in Baltimore County. And I'm here to say, you talk about a tale of two pandemics. I thought you were going to talk about a tale of two counties. I thought you were going to talk about us versus other places. But we don't have to look hard to see, had you not been so efficient, had you not been such a professional, had you not done all the things that were necessary to make people have a good experience and to be able to get the shot with ease, you can imagine that 1,400 number of the people who perished in Baltimore County could have been a lot higher. Just think about the people that would go, I'm not going because I don't have time to sit there all day. So that would be, clearly another 100 people. Think about the people that, if the staff were not as friendly and polite and kind, that would go home and tell their neighbors what a pain it was and how these people were terrible. And that would have resulted in another 100 people dying. So clearly, what you've done is save lives in Baltimore County, and we're very, very appreciative. And we can't give you enough accolades. And clearly, you know, what we should be giving you is a blank check, because memories are short. I know how it works. Pandemic come to town, we love you. Next month, we'll be talking about something else, and they'll be, you know, criticizing and trying to take away because, hey, you know, we didn't have this pandemic, you know, like a year and a half ago. Who thought about a pandemic? But I'm here to tell you, you know, we're going to do our very best to make sure you get the resources you need and continue to get the resources you need, because, hey, who knows how far, we're not out of this yet, but who knows how far to the next emergency, such as this. So, any additional questions or comments before we move forward?
Yes, Mr.
Apologize to our police officers and the chief of police who've been waiting. Yes, go right ahead, Councilman Felton.
Thanks. I just want to add to the comments of each of my colleagues. I would concur with Councilman Quirk that not only if you're a rock star, but also during the past year, you've been a rock, and you've been rock solid. And those are the things that we needed over the past year, when there was such an unknown. You know, we don't know everything about COVID now, but we know a lot more than we knew on our last, I believe it was our last council lunch, when you came in to tell us about you were talking about the WHO, and none of us really knew what the WHO was, but it was making us aware and attentive to an upcoming pandemic that we all knew very little about. And I can also recall going to a community meeting that night and trying to share what you had discussed with us earlier with community members, and saying we need to be attentive to this and be ready. And, you know, the whole community was saying, yeah, sure, Izzy, but what about this development project that we're all riled up about? And the point being is, none of us knew that we were going to be in a place that we have not been in over 100 years. And so somehow, Dr. Branch, you did know that we were going into that place. So thank you for alerting us to the place that we were headed over the past year, for getting us through the place we've been over the last year, and getting us out of the place that we've been through over the last year and some months. And so great job to you and your staff. Continue on. I think all of us have really gotten to our confidence in you. Certainly has, you know, it sounds like my colleagues have known you longer than I have, but certainly the confidence in you and your team has been strong, and has only grown over the past year and a half. I think we'll continue to grow as we work together into the future. So thank you.
Thank you, Councilman Felton. Any additional questions or comments? Thank you, Dr. Branch. Director Blades, give him that blank check, and so we can make sure he has what he needs. Dr. Branch, go ahead. I'm sorry. You're muted, Doctor.
I have nothing.
No. All right. You have our love and affection and appreciation and admiration. So that'll get you a cup of coffee. Thank you very, very much. Ms. Rogers.
I just want to also say we're also thankful to God. Dr. Branch, actually, you'll remember that he actually contracted COVID and had to recover in the midst of the pandemic, which was scary for us all. The thought that could potentially happen to our fearless leader through this pandemic. But we're thankful that Dr. Branch recovered successfully too. I just felt a need to acknowledge we didn't forget that you even got COVID. And
Well, that's right. In addition to all the other medals and honors, we're going to get them. We're going to get them a Purple Heart.
Yes.
Any additional questions or comments? All right. Thank you very much. We will move on to the police department. We certainly
Did you see anything?
apologize for running a little late. I'm sure you can understand and appreciate all the work that the health department did, and it's important we recognize. So on this note, I'm going to move on to, where's my little note? Mr. Scott Mitchell. He's going to lead us with the police department.
Thank you, Council Chairman Jones.
Sure.
Good afternoon, everyone. The proposed FY22 budget for the police department totals $267.9 million, a decrease of $30,000 or 0.0% from the FY21 budget. The general fund portion totals $238.7 million and increases by $2.0 million or 0.8%, primarily due to increased personnel expenses and operating expenses offset by the final police settlement payment in FY21. The special fund portion of the budget totals $29.2 million and decreases by $2.0 million or 6.5%, primarily due to the one-time FY21 grants and a decrease to the speed camera program. On page 2 of the analysis, the pie charts show how the proposed funding will be allocated across the types of spending. Personnel costs represent the largest spending allocation for the department. On page 3 of the analysis, significant changes in the budget are summarized, including a decrease in personnel expenses of $397,000, offset by increases in operating expenses of $2.4 million, with total net decreases of $2.0 million for multiple special fund grants and programs. On pages 4 and 5 of the analysis, various FY22 budget highlights are reflected, including some detail on the new and deleted positions, grant decreases, and provide some information on capital projects. Also on page 5, the analysis identifies no specific operating budget reductions. However, to the extent that the proposed budget includes funding for expenses that could be reimbursed under the $161 million in anticipated but not yet budgeted federal funding to county government, additional reductions could be made. More information on the spending plan for those ARPA funds may become available as the council considers the administration's request to appropriate those funds under Bill 4221, which is on the council's May 27th agenda. Other topics for discussion, which begin on page 6, include personnel, police reform, expansion and creation of various teams, COVID-19, special fund grants and programs, and capital projects. At this time, I'd like to turn it over for discussion, and thank you for the opportunity.
Thank you very much, Scott. We appreciate it very much. And on this note, Chief Hyatt, certainly sorry to keep you waiting, and welcome. We look forward to your presentation and response to the question.
Well, thank you very much. It's an honor to be following Dr. Branch. His team and Dr. Branch himself have been such incredible partners to us, particularly over this last year. Just a week ago on May 3rd, our leadership team presented for the Smart Policing Act. And during that time, we spoke about some of the challenges and accomplishments that 2020 brought with us. Again, I'm not going to spend the time that we spent last week, but it was a very difficult year, and despite that, I am incredibly proud of the work that our leadership team did. Some of them are on this call. I am also just very proud of the members in our agency that, despite the pandemic that Dr. Branch spoke in such detail about, things like the current climate that we're seeing nationally regarding law enforcement and so many other challenges, they continue every day to put on their uniforms, to come to work and to continue to serve to keep Baltimore County safe. And while our profession's continuing to evolve, and I know some of the specific questions revolve around things like police reform and so many other changes that we're making, we are going to diligently continue to work to build trust in our communities and to continue to keep Baltimore County as a safe place for people that live here, people who come to work here, and for people that visit here. And before Director Glazer and I go into specifics with some of the questions, I just really want to say thank you to the county executive and the administration, as well as to the entire council. And really that's for all of you, both for the council for your support as a group, but also your support as individuals. And just really, you have been incredible to the members of our agency. So I really want to thank you for that. And with that, I stand ready to answer your questions.
Okay, Chief, thank you so much. We certainly really appreciate you and all the hard work and dedication of the brave men and women of the Baltimore County Police Department. And as I said earlier, it was a team effort, and we would go to those vaccine sites and see police officers and firefighters and everyone else there. So we certainly appreciate your effort. If you could be so kind as to let's go into some of the, if you're done your presentation, what was some of the issues that the budget office had talked about?
Sure. So if it's convenient, I can just go through some of this list of questions and we can just fill in gaps if that works.
Okay, that'll work.
Okay, so one of the first questions had to do with the impact of the pandemic on our agency and, really how that changed our operations and some of the costs and savings that were identified with that. And to begin with, as we discussed last week, obviously the pandemic had a significant impact on our operations. One of the first things that we did was we mobilized an incident management team to be able to manage a lot of these operational and administrative changes that we had to do and continue to do to address during the pandemic. As you know, our police officers spend most of their time directly in contact with people in the community. So things like personal protective equipment and ensuring social distancing measures, and that we were able to sanitize our facilities and our vehicles and equipment were very important to keep our police officers safe and healthy. We also focused on things like prisoner transport vans, so that way we were able to keep as few people as possible in our patrol vehicles. We very early on, before any of it was obligated, were implementing mandatory health screening of our workforce, as well as arrestees that came into our facilities to make sure that we could minimize bringing COVID into our facilities. As things changed, whether it was, stay-at-home orders, social distancing regulations, the work that we did with the social distancing task force, and so many other orders, we worked very closely with other county agencies. Probably the biggest piece with this is that our incident management team really worked to reallocate resources. There are things that we generally do during the average year, whether it's public events or our school resource officers in schools, and with school no longer being in session in person, with public events being canceled, we had to focus on other things like crime prevention. We had large areas, business districts that had businesses which were completely closed. We knew that we needed to make sure that we were increasing our business checks. So we had a very specific strategy that we utilized our resources and reallocated them. We also knew that some of our isolated or vulnerable populations needed a different level of contact with us. And we put a lot of focus on making sure that we were still able to do outreach, whether it was, children, domestic situations, things like that. And then, of course, the sites that you mentioned, the security, the traffic safety for, testing sites, vaccination sites, and food distribution sites. We also really utilized technology wherever we could, moving our meetings, everything from our weekly crime meeting to so many other meetings to move them to teleconference. So special thank you to Rob O'Connor, because his team made those things possible for us. We shifted a lot of our police reports to telephone, so that way we could still provide our services to people that either wanted to be able to contact the police without having face-to-face contact, or at different periods of time when there were lower priority calls that we could manage that way. So again, we are still starting to open things up, but we are still operating in a slightly modified environment. Probably the last thing that I should point out, which is something that will absolutely be continuing beyond the pandemic, were the video bail hearings. And this was thankfully a project that we were already working on with the courts prior to the pandemic being in full swing. And that has been something that there will be cost savings that are seen for that, but also just something that was much more efficient, more effective. And during this pandemic, really was a saving grace to be able to continue operations. The next item, if there are no questions. I can't tell if somebody's trying to jump in and speak.
No, you go right ahead, Chief. I'll give everybody an opportunity to ask questions when you're done.
Okay, great, thank you. There was a question that was brought to us in reference to adding a management analyst for our grants management team. And right now, our grants management team, I will tell you, does a great job. But there are a lot of funds that are out there that law enforcement is eligible for, a lot of really good grant opportunities. And unfortunately right now, both due to staffing, due to the fact that a lot of these opportunities seem to be coming out more and more last minute, right now we are leaving funding on the table. And one of the things that we know is that last year for FY20, we brought in just under $4.5 million in grants awards. But if we get a couple of extra grants, this position will essentially pay for itself. It'll exceed the cost of the requested position. There are many more proposals that we would like to be able to be drafting. And just honestly, personally, it breaks my heart when I see a grant and we don't have the ability to put in a proposal for it, because I know that we have the ability to be pulling in more funding. So next up, we can move into some of the specific questions about the mobile crisis team expansion. I think Dr. Branch touched on that, so I will only touch on that briefly. Then we can discuss body-worn camera expansion, our mobile education team, peer support and wellness, and our internal affairs expansions. We did receive some questions on those. So the mobile crisis team expansion, as you know, is a collaborative between the police department, the health department, and the 911 communication center. And for the police department side, and keep in mind, mobile crisis, of course, includes our specially trained police officers, the ones that are in the soft uniforms, coupled with licensed clinicians that respond to behavioral crisis calls. So this expansion, just as a reminder, is going to increase our capacity during our peak day and evening hours. And this will allow us to respond to approximately 50% more of those behavioral crisis calls during peak and evening hours, and ultimately will allow us to return patrol time to our police officers, so that way they can focus on other law enforcement activities and spend that time in our communities. This expansion will also include the licensed clinician in our call center, and this will provide the ability that when a 911 call comes in, that we will have somebody who is capable of screening that call, making the determination of the appropriate care, potentially diverting certain calls away from police or from fire. And we will be very excited to be able to gain some traction and get moving with that. And I am very grateful to the work and the support of the other agencies, as well as the county executive's vision with that. In terms of our mobile training team, Really the concept behind this is a small group of trainers that we will be able to deploy around the county. So right now, our police officers really generally get training one time a year. And while I'm very proud of our in-service training efforts and some of the work we do, a lot of scenario-based work, we focus very heavily on de-escalation, on communication. There are many great things that we're focusing on, whether it's our fair and impartial policing, the ABLE training, the active bystandership. But the reality is that our police officers need more training than they're getting. And mobile training concept is something that I was involved in launching previously elsewhere. This gives us the ability to essentially take our training show on the road. So if we have police officers that are working out of a precinct, we could pull a couple of them together, maybe a couple of neighboring precincts, and be able to deliver, whether it's scenario-based training, training that focuses on things like active assailant. It could be on things like safely clearing a dwelling or a room, something that has to do with de-escalation, to continue to reiterate our training. This off-site training really is something that we can do to provide more regularity in our training, as well as, and I think this last legislative session really showed us how quickly things are going to be moving. If we are waiting to train our police officers once a year, we are not going to be successful with the pace that our profession is evolving. So this mobile training will allow us to quickly move training across the county. That will not be a detractor from what we're doing in in-service training, which in-service training is something that is consistent, and all of our police officers get the same training for that calendar year. We also got some questions in reference to our peer support and wellness team. And our peer support and wellness team, first of all, this is something that I'm very proud of right now. And part of the reason I'm proud of it is that it's something that we have people that have volunteered to really do in their spare time. We have people that literally volunteer on their time off to help our employees, to support each other. We have someone that's currently on loan from another assignment who we utilize, but it's not a long-term solution to deal with and to manage the wellness issues, the emotional and moral support that our employees need, particularly in these current circumstances. So this will actually turn our peer support and our wellness team into a permanent entity in the police department, where we have people that are intentionally assigned with the only role that they have to be able to be involved in peer support. And I will tell you, during the last year, there has been an extensive amount of peer support that our volunteer officers have been doing. And most large police departments across the nation have a standalone peer support or wellness team that is intentionally staffed to be able to continuously be moving around to precincts and assignments after critical incidents like the horrible one that we had on Saturday morning in Woodlawn. We rely on our volunteers, and they're wonderful, and they always show up, but they have other lives and other responsibilities outside of their volunteer work with wellness. So this is a place that we can really expand how we're supporting our employees during these difficult times. Another thing that we were asked some questions about were our expansion of the internal affairs section. And internal affairs is a place right now, with everything that is changing over the next few months and over the upcoming year through the legislative session, that there's going to be a lot of focus on internal affairs. And currently our internal affairs uses a case management database, which is called IA Pro. There is an accompanying software that most police departments are utilizing called Blue Team, which is a field-based tracking system, a reporting system that brings everything from compliments to complaints to use of force, vehicle pursuits, and a lot of other things, and brings it all together to be able to have less redundant work, to make sure that we are tracking things better, that we are monitoring deadlines and cases. And this is something that we are getting ready to implement, and it takes a significant amount of work to be able to do that. On top of Blue Team, of course, with the Maryland Police Accountability Act of 2021, we are anticipating a significant increase in our number of Maryland public information requests. And right now, this function, even before this legislative change, takes about 10 to 15 hours a week to complete. Based on what we're hearing elsewhere and what we're anticipating, we believe that we are going to be overwhelmed with the number of MPIA requests that are coming in. And this is a place that between some of the other work that's going to be coming out of the legislation and the fact that there's going to be certain information that's going to be publicly releasable that wasn't previously, along with other things like the upcoming statewide disciplinary matrix, the statewide use of force report. We know that we need to invest personnel, particularly supervision and administrative support, in internal affairs. And that's something that's very important. In terms of our real-time event center, we also received a couple of questions about building the real-time event center. And this is certainly a project that I wish had moved more quickly than it has. Unfortunately, the pandemic had a major impact. As you may remember, we applied for a CRITAC grant, which is through the Department of Justice COPS office, to be able to get support, technology support. And this project got a bit delayed with the pandemic, but right now it's in full swing for us. And our CRITAC subject matter experts are really working with Director D'Amato to make sure that as we build out this real-time event center, both in terms of physical space as well as technology, strategies, policies, that we are doing it and doing it the right way. So while there have been delays with this, this is definitely a multi-year project, but this is something that sometime during the second quarter of the upcoming fiscal year, we plan to have completely launched and ready to go. And we actually just started to shift some personnel to support it. In terms of other questions that we were asked, and I'm just skimming through them to make sure that I am not missing anything. We were asked about recruitment and retention challenges experienced, and certainly Baltimore County Police Department, like police departments all across the region and certainly across the country, we are struggling to attract qualified applicants. We are also managing issues with retention. We knew that we were going to have a significant exodus several months ago due to the 27 pay and just the way that worked out. But certainly right now we are seeing some patterns like we see elsewhere in terms of people that are eligible to retire, sometimes choosing to retire, and some of our younger officers choosing professions outside of law enforcement. However, I am extremely proud of the work that our team is doing, whether it's some of the virtual work that they've been doing, some of the recruitment that we've been doing with military returning home within local Baltimore County venues, some of the relationships and partnerships that we're building, and some of the work that we plan to do this summer. I'm proud of the recruitment efforts that we're doing, some of the advertising that we've changed to do, and certainly our recruitment bonuses that we added for FY 2021. We paid out 20 recruitment bonuses to departmental members, and for me that's a great start. We know that our best recruiters for the Baltimore County Police Department are going to be our own employees. So when our employees are out recruiting and we have people that graduate and are official members of our agency, they are receiving a recruitment bonus, which is an incentive for them to continue to refer applicants to us. So I am also really grateful to Director Benjamin and OHR for sitting down with us to identify some roadblocks or obstacles that we can manage to improve our recruitment process. And one of the things that we do know from speaking to our peers across the country is that police departments that can get through the process and onboard people quickly are the ones that get the applicants. They are applying to multiple police departments at a time. One of the things that we started working on last year, and we'll be nearing completion soon with the National Police Foundation, is an independent assessment of our entire hiring process. And they've already provided some ideas for us, some things that we're already starting to move on to make continuous improvements to our process. You know, one of the things that we've been doing already has been a rotating recruiter concept, and it has been very successful for us so far. So we will continue to focus on recruitment and retention. In terms of other items, I think that may be about it. Director Glanzer, am I missing anything?
I don't think so, Chief.
Well, there was one about the, I guess the Flex Squad and the school bus camera program appropriation. Did you move forward with the Flex Squad? And did we receive any money from the school bus appropriation program?
So Director, do you want to speak about where we are with the school bus camera program?
Certainly. No, we have not moved forward yet. Oh, I'm sorry. Miss Rogers.
Blazer, go ahead and add once you make your statement.
Thank you. There was a delay in the approval by the school board. And it was a decision was made to put the contract out for competitive bid. And I understand now that it is they may have completed their review of the proposals. And we hope that it will be implemented in the upcoming fiscal year, but nothing has started quite yet.
So nothing started on out in terms of.
Correct. We had to put all of that on hold temporarily.
Exactly.
Okay.
Chairman Jones, yes, I can speak to it. When the contract was proposed, was put forward last spring, the school board voted the contract down, which put everything on hold. So the school system, in collaboration with the administration, said, well, okay, do a competitive bid process. We went through that entire process this fall and in the spring, and they are finalizing their new candidate for a contract, which will have to go back before the school board. They went through a competitive process. Last year, we were using a competitive leveraging to leverage a contract with Howard County and Baltimore. The school board, the county school board voted that contract down, which literally put the project behind by one whole year.
Okay, thank you very much. Any questions or comments from the members? Okay, so Chief, I had a question for you about the, first of all, I certainly appreciate all your efforts. I had a question about the expansion of the body worn camera program. I was sort of shocked to learn that I understand why we would have detectives that would not wear body cameras. But what I was shocked at, if we had a warrant apprehension squad that put on a vest that said Baltimore County Police on it, and they were making an arrest in Baltimore City, for example, that we would have no body worn camera of that shootout that occurred. So the question is, with the expansion of the body worn cameras be issued to individuals like a detective who, when he or she put on that vest that said police and they were involved in a high risk takedown or arrest, would they be wearing body cam?
So just looking backwards a little bit, when the Baltimore County Police Department initiated the body worn camera program, it was initially focused on patrol officers and some other operational units across the agency. The plan moving forward will be to outfit every lieutenant and below and ranks below across the organization. We did have some challenges initially with some of the task forces, and this was a national conversation in reference some conflicts over whether body worn cameras could be worn. But our plan with rolling this out will be to finish and fully outfit the agency.
Okay, thank you very much, Chief. Um, I guess want to also give you, I guess want to give you my 150% support for the peer support program. It's very, very important that we make sure we do everything possible to take care of the physical and mental well-being of every officer who works for us in Baltimore County. So I certainly applaud all your efforts there. Any additional questions or comments from any of the members?
Mr. Chairman?
Yes, Councilman Marks.
Yes, Ms. Hyatt, can you talk about the hoist program we were talking about earlier and tell the council what that involves?
Absolutely. So our aviation program from 2008 until 2017 was involved in a program with a hoist, and this is something that was utilized in conjunction with the Baltimore County Fire Department, as well as during certain conditions with the National Guard in the event that rescues had to be conducted using our helicopter. Unfortunately, in 2017, as you know, there was a decision that was made to end our involvement with that program, and the equipment was sold. I am very, very happy to say that we are in the process of reviving that program. And while we are not certain of delivery with the equipment, we have already begun the classroom training. And over the upcoming months, once that equipment comes in, we will be training our personnel as well as the fire department personnel on it. And at some point in the near future, we will resume that program. And I am certain at some point that will have a life-saving benefit for someone in Baltimore County.
Yeah, where this becomes really helpful is where, parts of the Gunpowder Falls State Park where you physically can't get in rescue vehicles, and they'll be able to hoist the emergency personnel onto the river. So I really want to thank you for your help with that.
Thank you for the support with that.
Okay, any additional questions or comments? Well, Chief Hyatt, we certainly appreciate you very much and appreciate your staff. And I guess want to also commend you and your staff on an excellent presentation you presented the other day. That was a result of the Smart Policing Act. You had excellent presentation, and the department certainly on the right track. And we know you're a great department, and we're just very happy to have you and all your staff working hard each and every day. So I want to thank you very much on behalf of myself and all the council members and all the citizens of Baltimore County. Keep up the great job. Thank you so much.
Thank you very much, sir. We appreciate you.
Sure. All right. Bye. This will conclude our day today. Where are we, Mr. Boswick?
Yes, sir, Mr. Chairman. I think that concludes the hearings for this week, and we will start bright and early on Monday, not early, but we'll start at 2 o'clock again on Monday, May 17th, with fire, recreation and parks, and capital, including schools, capital, and debt service. Sure.
Okay. Thank you very much. You heard it here first. So thank you, everyone. Have a wonderful weekend. Be safe.
Thank you, sir.
Sure. All right. Bye.